So I'm mainly going to present the Climate App, which we have been talking about for quite some time. It's still a fairly new app. It was launched just back in March, but it's already used in, I see it's downloaded several hundred times, and I know that it's used in 10 countries already. And then we will have some practical use case examples of this app by Patrick and Tivonge. You can introduce yourself when you start. And then we will look into this what we call the CHAP platform, where we are seeing how we can use modeling and machine learning to make predictions for the future. And then after this one, so we will have time for questions within this session, but if you really would like to go into detail, see how the app works, how it can be installed, please just stay in this auditorium after 4, and we will have an expert launch for that purpose. So just briefly, the data flow, we are focused on 2 areas, and they are very connected. So one important work when we are going to combine climate and health data is to be able to harmonize the data so they are covering the same periods and the same districts. And that is a quite complex task, but we have tried to make tools that makes this much easier. And then we are also checking if this data is useful in itself in DHIS2. Is it useful just to import climate data aligned with the org units you have, the districts you have, directly into DHIS2 so people can see how the climate is and is changing for your districts? And then the next step, building on this, is to do modeling and predictions, because the tools we have, the triangulation tools we have in DHIS2 is not enough to really be able to predict if there will be a future outbreak. So the next step is then to use a modeling approach to see if we can make better predictions. There is also a link here between what sort of data we should use. So I will focus on global data, but we have also looked at local weather data and how to incorporate that into this platform. So for this reason, we have made this Climate App. It used to be called the Climate Data App, but we just saw that no one was using that name. It was just Climate App. So we will also change the name in the next version. This is a pilot app for this DHIS2 for Climate project, but we will make sure, we know it's already used in production. So we will make sure that this app is stable and something you can use over time. And yeah. It's the most easy way you can explore and import climate data into your DHIS2 system. You just install the app, and it's then you also need to have a sign up for Google Earth Engine, which I will talk about soon, and then the app just works. That is the only thing you need to do to have climate data for your own org units in DHIS2. It is based on currently the most accurate global climate set available, which is called ERA5 Land. And we don't look upon this as a replacement for using local data. You should always strive to use the best climate data available for your country, but it will be a replacement, and also a next way to sort of validate the data. If there are big differences between the local and the global data, there might be some errors that should be investigated. So this is the flow of the climate data. It's important to say that even though we are using global data here, it is built on top of local data. So we have all these weather stations in the countries. Some of them are fully automatic, and they share data every 3 hours with WMO. And then when they are in the WMO, this information system, they are then shared with different centers around the world. And currently in the forefront is this ECMWF, is a European medium range weather forecast. They are currently best in class on using this data and making it available for the public. So they are making two products. One goes back in time, is currently the one we have in the app, which goes back to 1950. And there is also a 10 days weather forecast, which we have also included in this app in DHIS2. But then through the Norwegian Meteorological Institute, this weather forecasts are not open data, but all the MEST offices in the world are allowed to distribute this data. And we are using an API that is made available from the Norwegian Met Office. So to understand what they do with the local data, this European Center, to make the global product, they use a technique called reanalysis. And I will just play a very short video, 2 minutes, that describes that process.
It is today more vital than ever that we have long and reliable historical records of the Earth's climate. Thanks to the abundance of modern observation methods, our weather records for the present are quite complete. The problem is, these observations are not evenly distributed around the globe, and there are also fewer and fewer of them as we go back in time. Climate reanalysis can solve this problem. It combines observations made in the past with today's weather model to deliver a complete and consistent picture of the past weather. Imagine the weather of the past as a series of jigsaw puzzles with pieces missing in some places and overlapping in others. The pieces we have are observations coming from weather stations, weather balloons, aircraft, ships, satellites, and other sources. The reanalysis is like a smart machine that uses the weather model to combine and process all the information from those pieces. Using the laws of physics, it is able to blend overlapping pieces and recreate pieces that are missing in a consistent way, thus restoring the complete puzzle. The reanalysis delivers a global picture of the weather and climate of the past as close to reality as possible for each and every hour, from the Earth's surface to the top of the atmosphere. The data produced by the reanalysis are widely used and provide many kinds of information, not only about the atmosphere, such as temperature, wind, and precipitation, but also about the ocean and the land surface. As such, reanalysis represents a comprehensive historical record of the Earth's climate and provides an accurate way to monitor how fast it is changing.
So this is then the data set we are making available in DHIS2 through this app. But what this is still some work to be done before we can align it with your health district, and that is to aggregate this data to the health districts that you have on your instance. So then we need to move into this data harmonization. So we also saw that people have tried to do this in the past with local climate data. This is actually taking the most time of the work to be able to harmonize the climate and health data. So what we do is that we have this agreement with Google Earth Engine that we can use for free. The Google Earth Engine is both hosting the data, but it's also giving away their computational power. So to be able to calculate that, we use just the geometric shapes, the polygons of your health district. Through the API, we use that on Google Earth Engine to then aggregate the data to your own districts. So just to show on a map, it might be a little bit easier to see. So you can see these grid cells here with different colors. They are approximately 9 by 9 kilometers. So, and these are the districts or chiefdoms actually for Sierra Leone. And you can say when there's a big chiefdom, many of these cells comes, or not too many, but they come within these polygons. And what we do is then to identify which one falls inside and then calculate the average for that district. And this is called common statistical GIS technique, zonal statistics. And we can do the same process also with local weather data. So we had a little hackathon last week, as many of you are in town. So we tested this with some local weather data from Malawi. and just did the same process. So especially if you have access to this map room, IRI map room, there might be local weather data available where we can run the same process. The benefit of this data is it's better resolution than the ERA5. It's about 4 or 5 kilometers resolution. So another approach here has been just to use data from weather stations directly. So Laos are trying on this initiative, and that is to expand the number of weather stations, so they at least have one weather station in each district. And then you can sort of align the weather and climate data in that way, getting it directly from the weather station. But it really needs to have that you have a full coverage of the country. So this is then the climate data app. You can just install it on App Hub. It's super easy. So just search for climate and then click install. We have made it backward compatible to 237. So it should work on 237 and above. The only requirement is that you need to have a key for Google Earth Engine. This is the same key we use for the Maps applications, for example, to access the population layers. So if you already have that key in place, it should work. And I see after we launched this app, a lot of countries have been requesting this key. So it should be, hopefully most of the countries here already have that in place. So when you then open the app, the interface is very simple. We just expose the org unit hierarchy you have for your instance. So here you should see your own org units. And then you can just click on an org unit and then instantly get climate data for that district. So we do this on the fly as you click on it. So these are some of the charts you can see. We have decided, because the import process it's not very complex, but just to have very easy access to the data, so you can consider it and see if it's useful. You can just explore the data directly without importing it into DHIS2. So by just clicking on an org unit, you can get this different type of graph. So here we have a temperature, both monthly to the left and then daily, so it gives you more detail. Often it is most interesting to see how the weather and climate is compared to the normal. So the dotted line shows the normal temperature, which is the average for a 30 years period. And then the line above shows the actual temperature. And you can see we had record heat, warm temperatures last year, so you can see it was above the normal for most of the month the last year. Then we also have data on precipitation. Again, we compare it with the normals because often that is what's interesting, if it's drier or wetter than the normal. So the light color shows the normal precipitation, and then the dark bar or column shows for the last month. Here again, you can go and see for multiple years and even the daily precipitation. So I see that this seasonality, how the season is changing, if season is coming later or earlier, is quite important. So we should also try to improve on the chart here to get that more clear. We also got quickly some feedback that for the countries that it was not enough to look at precipitation. Humidity was a very important factor. So now we also added that, and specifically the relative humidity, how would that change, showing that to the right. And then you can also look at the bigger trend. So this one is for this district in Sierra Leone, showing the temperature change. So I see that some people often get questions about this because you see blue bars and you think it's minus temperatures, and you say that is not right for my district. We don't have minus temperature. So we might change the color, but the reason we have the blue one is that it's colder than normal. and the red ones are warmer than normal. So what is the 0 line here is the normal temperature for that month, the 30 years average, and then each bar shows if the temperature for that particular year was below or above that normal. That one will often show you this trend. But now I've been looking at some of the instances for different countries. For many countries, this trend is not that clear as here. So please check for your own country. It also depends on what is the normal. And normally with climate, we use the last 30 years. So it's currently it's from 1991 to 2020, which is considered the normal temperatures. But also to see the climate change, the World Meteorological Organization also advises to you this 30 years period, 61 to 1990. And then you will see a much more clear warming trend. So it depends how far you go back in time. And then we have also included this weather forecast from the Met Office. So you should also now be able to check the weather in DHIS2 for every health facility. I'm not sure how useful that is. So we need feedback. And also if this should be presented in another way to maybe see upcoming heavy rain or upcoming heat waves. But currently we present it like this. We are also looking, we know that people not necessarily use another app. So we are also looking at ways of including this chart here directly on the dashboard. So you can use a dashboard instead. This is very soon coming. There has been a lot of attention on heat, and there has been record heat waves happening around the world, especially in the last year. So we are also looking at this indicator. It's not only measuring temperature, because often that is enough, but that is not enough. This indicator here also combines temperature with the humidity, with radiation, wind, and so on, to see the actual felt temperature on the body. So this is often better to use than temperature alone. And this is an universal indicator. So they have also made this, that you can read where you are in the different zones, and then you can see what sort of heat or cold stress that does to your body. So this is just because they had a record 50 degrees in Delhi 1.5 weeks ago. So I just went in and made this chart, and you can see the grayed area is like the top and the bottom temperature. So you can see it went into the day temperature, into the extreme heat stress. But it has been in the moderate heat and strong heat stress for quite a bit of the year. So when you have explored the data and you would like to import the data, you can also do that with the app. There is a very simple setup guide. So you need a few data elements to be able to import the data. But that is the work you need to do before. So create these data elements, and they should then show up when you import the data. These data elements should be pre-selected if you use the codes that we provide to you. So this is how you can import the data into DHIS2. And the good thing is that you, of course, can use all the analytics labs to look at the data, and you can also combine that with your health data within DHIS2. Can you trust the data? There is the good thing is often to have different data available, because we have seen also with the modeling, compared to what sort of climate data you use, you can also get quite different results. But this is actually proven to be quite accurate. So this is the first graph is the temperature for a year in Norway, and you can see it's all just the same. The one to the left is the ERA 5, and to the right is from a weather station. They also imported all this data into the Laos instance. So this is for a district in Laos. And then we saw that there was some differences. You can see that the max temperature are the two lines at the top, comparing local and this global ERA 5 data. And they are almost overlapping. But then there are some gaps for the mean temperature and the minimum temperature at the bottom. But then we found that the reason was that the local data, they only measure temperature between 7 in the morning and 7 in the evening. So that they didn't have night temperatures. And when we corrected for that, it was overlapping quite fine, as you can see on the top one. So temperature is they should be quite comparable. So it's a way of testing the data set. Precipitation is much harder because the precipitation you compare with is normally from a weather station, while this data set is for an area by 9 kilometers. So it's much harder to compare, but you should see the same trends. So this is some data I got from the University of Malawi. And I just compare with the ERA 5. So it's not exactly the same values, but you should see the same trends. This is not always the case. There might be differences in the data set. I think the reason why it was so quite similar here is that the station here for the local station is one of those automatic stations which actually feeds data into this global data set. So it shows the importance of that this data is being shared. And then there are also some limitations along the coast. This is this resolution of 9 by 9 kilometers. So we had an example here from Mozambique that it was on district on these 3 islands here, and they all fall outside of the extent of the data set. So we couldn't obtain a value. So you might, for coastal regions, you might see this limitation. So then I will hand over to see some usage.
Thank you. So thank you. Patrick Miel is my name. I implement DHIS2. So for this specific work, I'm supporting regional implementation, but I'm not just alone. I'm here with Tuonge, who is also a regional implementer. Is based in Malawi. And then we have some over there supporting the Asian region. So basically, the way we work is that when the team develops a product, that we work with the HISP group, but also with the ministries of health to implement this, but also give feedback. So some of the feedback that Beyond is able to get is really coming from us working with the ministries of health. And so for this, we've been able to get a few lessons that we are learning from the implementation, and specifically for those countries that have quickly adapted this. And those are some of the things that we want to share, so that if you're interested, you need to take note of some of the learnings that we've been able to get from this implementation. Yeah, so far we have about 10 countries, and these countries were here last week through their HISP groups to basically share lessons on what they've so far been able to learn, setting this up within their country instances. And of the 10 countries that were represented by the different HISP groups, we were able to get about 3 of them, saying we've been able to set this up in the national instance. But we know there could be much more that we are not aware of. But generally for this, we are just using them to learn from the experience. But the key thing we want to highlight here is the program areas of interest. We are seeing a lot of interest in malaria, a lot of interest in dengue, diarrheal diseases, respiratory infection, and malnutrition as really the top 5 areas of interest for this climate climate and health work. So just for you to know that, yeah, these are the areas of interest. I know sometimes there could be new areas that are coming up. And specifically, if you looked at this graph, you're seeing, there's interest for Sri Lanka to do this for education. So again, we are not limiting this to health, but as long as you're using the DHIS2 platform and you have something that you can do with climate data within your DHIS2, then you just need to, understand how that works and be able to use it. So, yeah. So for these 10 countries, basically, we've had some ways of getting started. And one of what I would recommend, especially for HISP groups that are supporting these countries, that, you need to understand the country. There's a lot that's going on each country you go with regards to climate change. So understanding the governance, understanding the action planning that's happening in those countries is very, very important, so that you can then see how to fit in. Yeah. For Uganda, where I've been working closely with them, I was able to find entry through the Ministry of Health, and there's a specific focal person. In some countries, there could be a whole office that is properly established that you need to get access to. But very important that you need to understand what are their priorities as a country, so that you see whether what we are doing aligns with the national priorities, and specifically with the national adaptation plan. It's important you understand the priorities in there. But most importantly, having this stakeholder engagement. We've been able to hold one for Uganda. We worked with Rwanda, they held one. This is also a very a good step to understanding what's going on in country. In that way, you get people to meet, and it helps you to understand the different stakeholders in countries. But it's important to make sure that you have at least the Ministry of Health people and the meteorology people in this conversation. But we also note that there's a lot of having a platform like that gives a lot of opportunity for people to start, thinking of some partnerships. For most of the times when we hold these meetings, people, get in the side and start discussing, I've been struggling with climate data, can I be supported? So in that way, you then start to have local partnerships that can actually help with country implementation. A good example here was in Laos, where UNICEF is supporting, with the weather stations. They've been able to invest a lot within Laos to be able to provide, weather stations for 148 stations, which is quite a huge investment. But that can only happen when you have this, local partnerships happening. Yeah, this was a meeting we held in Uganda, but also this is a meeting that was held in, this should be Malawi. Yeah, one of those. Okay, then the other thing is, of course, you exploring this data with your country instance. And that, of course, enables you to start, because if you're going to present to a country and you're not able to show them what's happening within their district, becomes very difficult. So installing this in within the country, either test instance or production instance, is very important. Then you can start exploring with things that people, with metadata that people can identify with. And this is in Rwanda, where they were able to, we did on the test instance with them, and immediately they put it into production. And in the production instance, they were able to do these beautiful graphs. Again, trying to explore, start seeing simple trends of climate and malaria. And that has actually, created a lot of interest in this application. This photograph you see over here has created a lot of interest. And it was because, they took that big step of putting it into their production instance and starting to look at this with real data. And that's really the best way to go, because again, installing this will not, mess up anything. You could try with a few variables so that you're able to appreciate. So the key thing is, of course, just making sure that you have the geocoordinates. Like if you're looking at district level, making sure that you have the geocoordinates at these levels, or whatever level that you find convenient for you, or you find more appropriate for this implementation. There could also be other areas. This is another example in Uganda, where there's a plan to set up a malaria repository. And for their malaria repository, they're looking at all these data sources. But one data source that they have on is, of course, climate data. So there could be program-specific places where, implementations of DHIS2 that's happening in country, and also where there's a lot of interest. That could also be another place to start. But that, of course, in some ways may bring some challenges around managing the data now, because if you have data installed on the production instance, which is HMIS, you have this data on the malaria repository, then you then start to have data in different places. So that also now calls for us to have, a bit of strategy on how do we then have one place that you have this data, that whoever wants to use in any of these instances could actually access, so that you don't have data being imported all over, or find easier ways of moving data maybe from one instance to another. So we need to really see, depending on that country implementation, see the best way to do that. Yeah, so, but the other one that I wanted to mention, and this came in some of the demonstrations that we've made, the volume of data. And just to say that it largely depends on your where you importing this data. By design, you can import data at facility level. You can import at sub-district. That could be something between a district and a health facility. You could import at district level, or you could import at provisional level. So, but you need to see where do you do your analysis? Where is it? Where does it make sense to analyze climate data? Do you want to analyze climate data at facility level? Maybe it doesn't make sense. Yeah. But maybe at district level, that makes sense. Now, if you use that district level implementation, and that was the example that I was giving for Uganda, where we have about 140 districts, and you're doing daily data. So for one variable, you should have about, in a year, you should have about 53,000, values imported for that one variable. But if you compared that with surveillance data that we equally report on weekly basis for 7,000 health facilities, yeah, you would have, for that, you'd have about 364 values imported in a year for one variable for surveillance. So meaning that really, if you implement this at a district level, it's not much. 7 times much less than surveillance data. So it's important that we communicate. Otherwise, people think daily data for climate, that's too much. But it's not as much as it should if you're doing it at district level. And again, we are not looking at 30 parameters for climate. For now, we are doing about 6 data elements. I'm sure for surveillance, you have much more than that. So just using that comparison for me gave me confidence that, we shouldn't so much worry about the volume of data that this will be bringing into your DHIS2 instance. Yeah, so I will hand it over to Onge to just take us through some of these analytics and the gaps that we're starting to see within the data. Over.
Right, thanks, Patrick. Good afternoon. Yeah, so I think Patrick has talked about, importing the data and also trying to build a story that we can use as a basis for communicating with various stakeholders, both in health and other sectors, because I think the use cases of value also extend beyond, the ministries of health. You may have health, like, within agriculture, for example, which is also one thing that we're exploring. But whatever the case, for us to be able to engage, in processing this data and having a conversation, it's important that we should have, frameworks in place to guide the types of analysis that we want to do, and also how we would want to communicate the analytical products within the countries. And also, it's imperative that we work with relevant experts within the domains, because this is an interdisciplinary field. So you, for example, work with med services, you may have to work with health experts, and also IT experts, whole data modelers in various cases. So within this analytical framework, you can detail who has to be involved, and as I've said, what sort of analysis has to be done and how this can be communicated. But also, given the data that you may have available, you can best decide what sort of analysis may be useful. So for example, in the maps that you see on the right, so where you have the red and green, that's a malaria suitability mapping. So where you're looking at the intersection of precipitation and, where you're looking at the intersection of right temperatures for parasite breeding. So for malaria, which is between 18 degrees and 32 degrees, and where that intersects with relative humidity. So where you'd have, for example, relative humidity above 60%. So with that, it's just a suitability map to say, okay, where you have that intersection, then the conditions for breeding may be present. Where there isn't that intersection, then the conditions may not be present. So you'd produce such types of analytics and then use that for engagement. And then now what you have at the bottom there is borrowed from the one presentation area on from the National Institute of Public Health from Mozambique. So which is showing the combination of climate data and also other data sources. So to arrive at a health vulnerability index for various districts and provinces in Mozambique. So there was the climate data being drawn in and also factoring into that, looking at other relevant data, for example, human resource and budget for health, wash facilities or indicators, and also other social determinants, and then looking at the environmental sensitivity of particular health facilities. So all these various data sets being put together to produce now this health vulnerability index for the country. So I think that's useful, but also there is some things that need to be kept in mind that I'll get back to in a short while. So in trying to do these various analyses as well, it's important to keep in mind, as I've said, what analytics you may want to do, but also the data gaps that may be available. So to say, okay, for the analysis that you want to perform, do you have the relevant data in place? So I think earlier on, Bjorn talked about the heat stress use case, but in some cases also in countries, the availability of this data may not be, that solid or the index. So it's important just to do the mapping out and also assess the availability of the data. And given the data that's available, you can then determine what sort of analysis or modeling may be useful. So, for example, for some statistical models, I think based on other stakeholders we've engaged, you may need, for example, maybe weekly data. So like the WHO is supporting various countries in implementing an early warning and alert system for malaria. For this, there's need for providing weekly surveillance data. So in some countries like Malawi, initially, in cases where there were gaps, they had to then have efforts to consolidate that type of data. So it's important to understand the data needs. And also, for some models, you may require an extended period of time for which data is available to make sure that the outputs from the models are essential. But even in the case where you may not have data for, let's say, over 10 years, there still can be analysis such as this suitability analysis that can be performed. So just check what sort of data is required for what types of analysis, and if you have gaps, what the best alternatives are in terms of the analysis that can be made. And also in the previous talks, let's say like by Bjorn, there's the talk about using global data sources as well as local climate data sources. So with the global data sources that we leveraging through the Climate App, we have a good starting point, and also there's a great level of accuracy within this data. But in some areas, I think there are also some notable variations. For example, in some cases, you might have an overestimation of the rainfall or the number of rainfall days. So utilization of local data would be useful. But also in the various countries that we've collaborated with, I think it can be a bit of a challenge to engage also meteorological services or to have intersectoral collaboration. So it's important, as Patrick said, to understand the local dynamics and governance structures, and to have the Met services on board, so that we have collaborative work that furthers the national interests within particular countries. And also the key thing within these types of partnerships is to work in a way that's mutually beneficial. So we can leverage climate products from the Met services, but not just as, data accessors, just plugging in, pulling the data and then vanishing, but we can also look at the efforts that they're engaged in and, where we can have mutual benefit. So, for example, Mozambique has collaborated with the Met services to support digitalization of data, and then also to develop some other platforms that can enhance the digitization of data, but also data sharing. In Malawi, we also doing something similar. So some of the pictures that you have there, like the one at the top, is where we had work sessions with the Met services to see how we can leverage the data that's available, but also how we can contribute to the work that they're doing. The leveraging of local data is essential, because also, as Bjorn said, you can have higher resolutions by utilizing the local data. So like what we have available in Malawi via the map room is, a resolution of 4x4 kilometers or 5x5, which greatly enhances the types of analysis that you can do. And also based on use cases, so I think there's an extended set of climatic variables that can be provided, or that the work that's being done can support. But Bjorn did talk earlier on to say, at the moment, there's just a limited set that's provided or supported. And that's based on the use cases that have been put forward, but there are possibilities to extend the types of analysis or the types of data that can be provided. So I think feel free to also engage with the team, and then to indicate where we may have need for additional parameters to be supported. And with this type of work, we working with different stakeholders and also across sectors. So as I said earlier on, you need capacity across various areas. For example, meteorology, public health. You may need expertise on entomology based on the use case that you're following, or data science, epidemiology, and etc. So it's important also across these teams to make sure that everyone has the basic understanding of the terminology, the data that's available, and the types of analysis that can be made, and also the potential stories that can be built out of this, and the potential impact. And it's important to have in place capacity development mechanisms to ensure that everyone attains the right level of capacity within the team. And also to guide this, then it's imperative that we have in place a framework for assessing the needs, and also on how to develop the capacities that are relevant. And within the various countries, there are various stakeholders that are engaged in climate and health efforts at different levels. So we can leverage the local networks, but also global networks, such as what we have here, to build capacity and tap into available capacity. And one thing that I would also want to emphasize on is that with this, for example, we would have to pull in data from different systems, which has been talked about. So it's important to understand the available data infrastructure within countries, and also the variations in the data that's captured and presented. So just to concretize that with a use case from Malawi, we also exploring an early warning system within the context of malnutrition. So meaning that we have to pull data from the National Agriculture Management Information System, and there's also a nutrition information system, then leveraging possibly the local or global climate data. And then some data sets are available in the health management information system, which is an aggregate system at the national level, but there's also a community level information system. But all these platforms have data at different levels of granularity. Data is collected at varying periods, and also the reporting structures may be different. So it's it may not be that easy to combine this data or to find a level at which you can make unified sense of the various data sets. So I think understanding the landscape and then trying to locate the most appropriate level where you can have sanitization of the data, where you can have more representative analysis may be useful. So for example, if you move maybe very low to the community level, you may have challenges aligning this data. But in some cases, you'd find that in as much as you may have varied reporting structures sub-district, still more, you'd have unified reporting at district level. So maybe for some use cases, it might be best to start with reporting things at the district level. But whatever the case, it's important to understand that data infrastructure. So also just talking about the networks, then we have the global HISP network, and within the various countries, there are country HISP groups that can be contacted and can be worked with. And also there is a significant documentation online, through the URLs that have been provided there. And then there are also various avenues for training that can be leveraged. And also there is an online community that you can engage, and also the routine communications from the network and the community. So for example, monthly newsletters, there's a mailing list, which people can also subscribe to and get updates. And within all this, we want to work together to expand the network and also to empower each other. So I'll hand over to Guy Shetter.
So over to something entirely different, fishing. This is actually a quite new logo. It came last week from after Eden made the point that everybody have talked about this CHAP, but nobody have seen it. So it's kind of selling a fish in a river, or selling the skin of a bear before it's shot, as we say in Norwegian. So this is a chat platform, which I'm going to introduce to you today. I'll start with an example question. So can we, based on climate observations and forecasts, predict malaria incidents better than something we already do in the coming season, or maybe the coming weeks, to better prioritize campaigns, interventions than what one is doing today? So I think that is a very, very relevant question. I think like the trick is in very small letters, as it always is. Can it be done? And would it be useful to the level it can be done today? So first, why do I believe that modeling is needed, or at least very useful for climate database decisions support? So this is, for instance, Laos data on cases and temperature. And you can try to see some kind of patterns here by eyeballing, but it's not really robust. So I think that when it comes to, let's say, malaria, where temperature and precipitation will influence the mosquito life cycle, the parasite, the human behavior, this is very complex with complex time dependencies. So it's not like, oh, it got like 3 degrees warmer, now it's twice as much malaria. So it will be very hard to do it by eyeballing. Also, you want to do it for many districts, for many time points. The second reason why I think it's good to have a bit of models here is that we want to build evidence that it's useful. And if we do it more like pure manual process and only kind of try to estimate it in an individual district based on a human intuition, it's hard to kind of see how well that human intuition worked. If we have a quantitative system, we can do a bit like Björn talked about with the reanalysis. We can go back in time and we can try our quantitative model. We can see what it would predict, and we could see if it would have gotten it right in the past. And that is a very nice way of kind of stress testing whether something seems to be working well. The third thing is that we want to know which questions are successfully informed by modeling. So say something like predicting malaria 6 months ahead versus predicting malaria 2 weeks ahead. It's two very different aims. If you predict 6 months ahead, it leaves a lot of time for trying to do interventions. If you only have 2 weeks, maybe nothing can be done anyway if you only know that there will be an outbreak 2 weeks ahead. On the other side, maybe these models work very well for predicting 2 weeks ahead, but 6 weeks ahead, they are purely guessing. So for that reason, we want to see how well the models are working, how far ahead can we go, what kind of decisions can we truly support, and then we again want a quantitative model so that we can a bit like systematically explore what is possible. So how does it work? Well, you take the health data from DHIS2, you take the climate data from ERA 5 or from local observations, you harmonize these to the same districts already done by the climate app, you put it into some kind of model. In a previous session on machine learning, Michelle Evans, for instance, in a project in Madagascar, showed one model they had used there, a Bayesian model, can be done in a lot of ways. You learn the relation from temperature to disease prevalence, how it influences disease prevalence, and you typically end up with something like a risk map. So this is from Vietnam. In which regions of Vietnam is there a high risk for an outbreak in January, for instance? So a lot of these models have been proposed about the literature, and we discussed in this machine learning session about like the difference between academia and operation. So a lot of these have been published. It's actually 99 models were reviewed just for dengue. Only some have been made in software, and those that have made in software are maybe not the kind of what we would term software actually here in HISP, because it's kind of scripts and it's very hard to run them. And that is a bit of the academic sector, how it works, unfortunately, I think, because I'm part of it myself. So actually, our first aim, to be honest, I'm a machine learner, so my first aim was to make model number 101 for this. And I think we will actually do it. I mean, that is still interesting and important. But we also need to make sure that these are not kind of, as Christian says, palytitis as part of this disease, which is it's made, it's funded for a period, it's published, and then it's kind of impossible to use it from then on. And then it has to be reinvented every time. That is not what we want to do. So what is CHAP? Well, it's a soon upcoming DHIS2 app that can be installed in test instances maybe first and then production, to forecast, for instance, malaria or dengue incidents. And we also want to expand beyond. It's also the start of a software platforms that integrates many of these prediction models that are available in the academic literature. So we don't just want to develop our own things, but we want to take a lot of these things that have been published, maybe have not been followed up after publication. We want to move them into this platform and make them available to any country that wants to do this prediction. It's also an invitation to all of you and the rest of the world to join an open source development. We will not put it up on GitHub when it's finished. We have put it up on GitHub already. We are a bit embarrassed maybe of the state of the code now, but I think that's how it is. We should open it as early as possible to make so that you can see that this is not perfect. This is very simple. This is very limited. And it's an invitation already now to come in and join us. It also will be an opportunity to share experiences and use cases. Because if we have a bit of a generic system, a generic prediction system that many countries can use for many different diseases, then one can start sharing experiences to say that I found this 0 in my malaria data in this district. Does it mean really 0 cases or that they didn't put in anything? And then we can do a feature request and we can improve DHIS2 and we can improve the models. So that's how we want to do it. Be a bit on the same page in order to also share experiences and together make something really good. So the motivation for it is that we saw that a sophisticated prediction model is only the start. Just come on. Yes. It requires a long-term ambition and a very concerted effort to succeed. You need to be able to tailor the data to availability and country district needs. The model cannot be the same everywhere, not for every disease. We need scalability and we need to integrate with the routine health system. I guess you see where I'm hinting at. Unbiased assessment to prioritize prediction targets. What do we want to predict? And also to build trust. And we also need a process for organizational change to exploit these opportunities. I mean, if we can predict ahead, we also, it's not like one already knows exactly what decisions that should be taken. One also needs to develop over time the processes to take these new opportunities into account. And finally, it's we need continuous improvement and learning as being part of a community when we do this. So this is how it is today. This is how we foresee this to be, and it's actually, Herman will actually show a demo of how it works. You have a DHIS2 system with a data administrator. You have this, what we'll call CHAP, which is then perfectly integrated with DHIS2. Takes in climate data from Google Earth or local sources, gets health data from DHIS2, runs a lot of different prediction models published in the literature, feeds it back into DHIS2, where it can be, where you can predict ahead in time and where decision makers can look at where in the country at which time points do one need to do interventions. And as part of this, so this is kind of the final user, data administrator setting it up, installing the app. And as part of it, we also foresee like a data scientist from the individual countries being involved, doing evidence building, trying out, modifying, tailoring, developing new statistical methodology to make it work better for the needs and the context in that country. This is a bit more technical. I will not go so much into it, but the point is that it's connected with REST APIs, working on virtual machines that one can set up as part of the DHIS2 system in countries. And we can rely on dashboards and visualizers that's already part of DHIS2. So how will we do it? Well, and this is not my field, I'm a machine learner, but I see people in the audience here. So I think like this social technical perspective on machine learning development is crucial. And that we saw earlier today from Madagascar, so that I found very interesting. And that's IT system development, including AI and machine learning, it happens always in a human context. And operation uptake rests on long-term collaboration, advocacy, and trust. So we are hoping for an 8-year project here, and we will not be finished after 8 years. We will continue for, I have thought now 25 years is about my max. It's a bit scary, but people seldom do this to machine learning and AI. And I think all this experience in the HISP network can be used now going into machine learning and AI. How do we actually think about organizational change and exploitation of opportunities? Then we need to put it into scale. It needs to run at regular intervals, like weekly, on routine health data, accessible nationally, but also directly at the district level. And that is crucial, I think. And here will DHIS2 come in. We'll do it by integrating with the DHIS2 system, and we will have the underlying software scaled to many countries. We will not develop it from scratch, but we will jointly develop generic code that can be tailored down to the countries again. And we will share innovation. So if a very good model comes up for instance, Tanzania, we will take it back again to other countries. That was the case earlier today. Then the evidence building and prioritization of what to work on. I think today a lot of the assessment of how well something works is done by the same people that develop the model. And that is maybe also why some organizations have a bit of distrust to it. Because it's based often on the same assumptions, same criteria, same regions as where it was done during development. And it's a bit hard for others to say, like, will it actually work 2 years ahead in time? Can we trust it for the future, even though it worked in the past? And something that worked well in one country, will it actually work well in another country? There's very few community developed reporting guidelines. What do you need to know in order to trust the machine learning model? And there's limited of these kind of global benchmarks. So I think we, as a community, I think it's really great if we can contribute towards this. Because countries need to know what works well. The field itself needs, the scientific field needs objective assessment using extensive data and relevant metrics. That was also a topic at the conference earlier today. We need to know what is like really matters for the decisions. And we need to run many models side by side then that are flexible in what kind of data they take, so that if Björn is able to give us a new type of data like humidity, that the models can now easily be expanded to also exploit that. So we want to make machine learning software great again. And I think a lot of people out there in the field, maybe not so much in our context. For many of them, the software is just like a reflection, a shadow of a mathematical model, because mathematics is great and software is boring. But for someone like myself, to me, I see software not just as a kind of a passive reflection of mathematics. I see it as a construction that allows reuse and improvement. And it's really challenging to make a machine learning system that can be used in 74 countries. I think you know that with DHIS2, right? But that is what we want to do. Because we want to avoid the duplicated code writing. That is one way. But there's also ways for that all of us, if we want to try 5 different models, that we have to kind of look in and read the code of 5 different people. So that's also another way why we want to avoid reuse, to make more reuse. If you do it all from the scratch every time, there's increased probability of bugs. I saw Marcus talking about the bug bashing in DHIS2, right? In DHIS2, there's probably now thousands of bugs. But that's because you have a bit of control of the bugs, right? You know the bugs, you get the bugs reported, and they are not kind of just like silent bugs. And that is another argument for having reused generic software. We want to kind of discover the bugs and actually get rid of them, not just have them like hidden around there, including the Aedes mosquitoes as a bug. And it's hard to compare and actually choose between models. So that's how we go back to HISP and the DHIS2 as inspiration for how we will want to do machine learning. We want to have it different. We want to have it reused, tailored. Innovations can flow back. And it's a bit of the same like DHIS2, lived for 15 years, tailored to 70 countries. All of these kind of really great developments. And we have the same with CHAP, lived for 15 weeks, tailored to 0 countries, but it's an increasing number. I mean, it must go up from here, right? So what we aim to deliver, and now I'm selling it a bit as a fish in the water. It's actually starting to get a bit up because Herman will show that we have some things running. So we want to tailor to needs, build evidence, put in operation. It's going to have different components from getting the data into the system through DHIS2, harmonize the data into health regions, streamline all these models out there in the literature, put them in, do historic assessment to build trust, and to have some kind of a brokering system that allows all of this to be connected. The way we will develop it is, again, a bit like HISP style, I think. We want to focus on meeting real needs from the start. It's not just like some kind of academic effort, but it should meet the real needs on the ground. And we need to learn about what these needs are. We will have short iterations. We want to have a long-term ambition. This should run for 20 years. But we want to have the first system running in something like October. And we will have statistical models of good mathematics, but also robust software implementation. So we will do close collaboration. It will be developed partly by the global HISP team and partly by developers in countries. We want to do the software development and socio-technical perspective and open source from the start. So this is how it looked on PowerPoint. And as a machine learner, I'm always very skeptical to PowerPoint because it's so easy to sell something on PowerPoint. So then, Herman, you can try to show that this is a bit coming out of the PowerPoint.
Yeah. Now it's up to me. Everything relies on me.
And if it crashes now,
yeah,
it's really bad.
Okay. Just. Okay, yes. So we have developed, we call it a proof of concept. I think the most correct thing to say. And it's not finished yet, but this is currently a DHIS2 application that are meant for a data analytic in a country, for instance, in a Ministry of Health. And as Kjetil said, these models we are running, they require some data. For instance, cases of malaria, temperature, classification, and so on. So what we are doing with this application, that are we defining which element are we going to send to CHAP. So I'm going to do that now. So the first thing I select is for which element do I want to predict. And now I choose malaria. And I also choose which district we want to do this prediction in. So we can take that, the tree first here. And for a level, it's stay for district for now. And some of them also need population data, how many lives in each district. So I also plot this in. And temperature data, they are pre-select here. Both temperature and precipitation are needed, but leave it as it is. And I also want to do, say for how long are we going to train this data? Because these models, they need data to be trained on to like identify this variation between climate factors and cases. And for now, we are doing, for those who are familiar with machine learning, there are often like two phases. We first train and then we predict. But in this application, we are doing very simply. So we just train and predict in the same operation. So now I'm going to take the last 12 months where we train. And, okay, yeah. And then we are sending this data to CHAP. And for now, everything is run locally. So I just send it to another Docker container, or CHAP is run on my machine. So now we see that CHAP is working on this data and doing this modeling. This will take maybe 40 seconds or something. So now we're training or sampling.
Very slowly.
Yeah. So we can forecasting the next step now. Yeah. Yeah, so there we are finished. And now I'm going to take this data back into DHIS2 again. So first I'll show the result, what CHAP has created. And what we see here is a chart of how CHAP think the malaria cases will be for the next 3 months. And at the top here is like the red point here is like the worst outcome of malaria cases. And the blue one is like the median at what will be most likely happen. And the bottom here is the best case. And so we'll go on for the next ones. You can see for the different districts that they have created a slightly different prediction. And lastly, we select where we import it into DHIS2. So we can visualize it in Data Visualizer app or Maps apps, for instance. And now I have created this already, so I don't need to do anything. But then I select CHAP Quantile Love, and then could import it into DHIS2. Yes. Yes, so this is this application very, fast and briefly. So, now you're seeing us. Do you have there? I just have one slide. More. We need to figure it out together. Yes, and just as I said, that this app has some limitations when it comes to it requires local CHAP instance, so it's actually only meant to be a proof of concepts. And also, as I said, it's doing this training and prediction in once, so this will be split into 2 operations. And it's also, as you see, I selected climate data from DHIS2, and in further releases, it will be more likely that this is fetched directly from the source. And it's also possible that we will create like we can do multiple jobs simultaneously. As you see here, we can have a list of different jobs. For instance, we have dengue for Laos that run every daily at 3 o'clock, and another job that is run every Saturday, that for another province for malaria, for instance. Yeah. So this is like how it will look like in the future. Yeah.
Say there that we are ready now for people to try this out of businesses. So if any country wants to try it out, we're very happy to start a collaboration with them. Out of battery.
Out of battery. And you just swap, huh?
Yes. No, I just wanted to, just thought that, wanted to say that we are ready, it's ready to be installed. So for those that want to set up test instances of the DHIS2, start to see it out in operation. We are very happy to work on this and develop it together with you. And we are very happy if anybody wants to join this development, that there are perspectives on how it could work with more information on its needs, the decisions that crucial needs to be supported, or by statistical model development. Yeah.
So we'll very soon move on to questions. Remember also we have an extra hour. We'll be in the same auditorium. Of course, if you need to leave, you need to leave, but please stay and we will have plenty of time for questions afterwards. I'm just showing a few more examples of what we have been working on. I originally have worked on the DHIS2 Maps app for 8 years, so, and that is not forgotten with the climate work. So one thing we have been looking at is to bring in more data set into the Maps app. For example, if there was a big flooding, as you can see here, this is from the big flooding in Pakistan in 2021. We have access to very detailed satellite imagery, 10 meters resolution, what might be able to do as a crisis response, for example. So you could, bringing this data, for example, have the layer of health facilities, and you could see what health facilities are within these flooded areas. So here you can just see there is a little transition between the normal satellite photo of the normal situation and then going on to the flooded areas. The last one here is we are also there has been a lot of feedback that people would like to have data on air pollution. Often this needs to be measured on the ground to get the very detailed data sets, but there are some global data sets, and we will also try to incorporate that in both the Maps app and also in the Climate app. So you can see how the air quality is throughout the year, for example. And then there are some additional resources. This has also been shared before. You will have the slides so you can go in and see, especially if you would like to use the Climate Data app. I recommend this webinar that goes through the whole process. I would also like to mention that since Esri is also in the room, that they have a lot of data on climate change and also a lot of GIS capabilities you can do. So, and there is a new connector that was presented yesterday. So please also look into their resources and see what you can do there. So we are ready for some questions. Are there any?
Hello, yeah, now it's working. Just to turn it on, Geshetel, it's very easy. Okay.
Sorry. Right. Thank you very much. So, all right, it's good you are here. So the question is actually too. So in your demonstration, I saw you selected the population data. I want to know the role that it is playing in the entire model. And the next question would be, do we have any idea of, say, in the next future, bringing a prediction onto a spatial map? Do we have that? It's more or less my area of specialty, so I want to know if it's something that the team has in mind If not, then we can probably collaborate and then think about how we can go about it.
Yes, I can try to answer on those, and I'll look at Knut, but I think the population estimates would come in mostly in terms of like how many would get immunized if models take that into account.
So looking more like risk, risk analysis.
Yeah, or something that if you have if you have an outbreak that lasts for some while, then a bit part of the population would start to become immunized, and then it would lower a bit. But I don't think it plays a major role in these models.
Okay. Yeah.
Yeah. For the other, yes, spatial maps, definitely. We have just like started looking into that. Would be really great to look at, because I think that seems to have been the conclusion in the field, that like maps is like really good for decision makers in order to do like regional prioritization and so on. So that would be great.
Yes, Geir-Kjetil and Bjørn, this is of course extremely interesting and impressive as well, I think. Particularly the speed the development has happened over the last months is very impressive. But then also I ask myself, are we moving too fast in a way? You know, is the development going too fast? And we all know that weather is not the same as climate. And we call it a climate app now. Maybe it should be called the weather app, because I'm asking myself, what you mentioned that it has been taken into use in some countries, you know, already, the climate app. And I ask myself, for what reason? What do they use it for? What is the actual use of the app today? If the limit, what we want to do is to foresee, we want to predict what's happening in the future. Comes to nutrition, this is months ahead, half a year ahead, next year maybe. And the weather forecast in the app today is 10 days, isn't it? So can you say something more about it? Just clarify a little bit. What is it being used for today? Is it just being tested? And what is the sort of timeline that we can foresee something today? I think that's very important. Thank you.
No, I agree. The naming is of course relevant. It's maybe not even like it's very hard to find a descriptive name. Climate, it can be said that it is climate data because we are actually going back to 1950 with the data set, and we consider climate to be more than 30 years of data. We talk about more climate change than weather data, but I agree, it's both sort of data. It's also, we plan, if we bring in air pollution, maybe areas of where the wetlands are, for example, it will be more Earth observations. So the name, finding the right name will always be difficult. We could say that we are moving too fast, but I would say this work we are currently doing is not that this will be the end product. This is to raise awareness. So we also get some feedback from the countries. I've never seen this sort of data for my health district before. So being able to dive in, even though we don't have all the available data set there yet. The problem currently with the meteorological data is that the data in the past is publicly available. If you move into the future, it is still not the open process around it. So sometimes it's harder to get, but it is on the agenda to bring on especially seasonal forecast, which probably will be much more useful than the 10 days forecast. So yes.
Can I just say a bit? I mean, yes, we are moving fast. We started 1st of March. And when we say it in use, of course, it's in the experimental use. But as of now, it has created a lot of awareness and advocacy in stakeholder workshops. In Rwanda, they are testing, using it in operation for planning, but also more for advocacy to get awareness that weather data or climate data has an impact on diseases. So I would say at this point, it's more for advocacy, to raise awareness, to raise preparedness, to mobilize the health programs in order to be seeing what do we need to prepare for. So as of now, this is in this stage. We are more on the descriptive stage. The prediction model hasn't started yet. So then it's more for advocacy, more for raising awareness, raising preparedness, thinking about where should we and why, who should learn from which district, and looking back in history and having this kind of conversations with the health program. So that is the stage we are in now, I would say. And there's 4 countries that have it on operation, 6 in more test dev instance. We have one over here.
Yes.
Maybe I can do it.
You can do it.
We see who's running fastest. Whoops.
My question is good for, not for that.
Yeah.
Yeah, it was super amazing to see CHAP and the prediction there. I have a lot of questions and I will bother you after that. Some of them is about model selection. When long-term C, you were saying to have more a catalog of model, and I see that the platform can be requested through the REST API to interaction with DHIS2. Can we imagine having an intermediary platform that would do transformation that are requested by the model that cannot be done in DHIS2 to add them on top of it? How do you see those more complex? I will take a concrete example, like for malaria. When you see other projects like Malaria Atlas projects, the methodology are not based on clinical data. They're not based on routine surveillance data systems. They're mostly based on DHS and other survey, at least in the African region. And when you try to apply methodology that take clinical data or routine surveillance data, you have correction that are recommended by WHO. You have a lot of different steps before getting there, and gap filling, interpolating the data, which are the real data, like not the Sierra Leone play, but when we get there. And what would be the strategy there with CHAP, and what's possible for us?
Yeah, I think it's a really, really great question. Thank you. Sorry. Very, very difficult question, but I think, and I think this is also why we want to have this as a bit of a tailoring approach, and as kind of something we build together and as a platform. And it's also why we want to integrate closely with DHIS2. And I think there's a lot of interesting decisions to be taken there. We want to actually, that is also why we want to run fast, because I've heard some people say like, oh, isn't it like scary to put it out there like already now when it's not finished? But I'm feeling more like I would be like me, we would be very scared to work on this for 1 year before we actually start getting feedback. So I think this is exactly the kind of questions we want to actually try out in real production, then on a test instance, but in a real production setting. And for instance, one question I'm thinking of there is that should this, all the data preparation, you can say, or data harmonization and normalization, should it be when you move from DHIS2 over to CHAP and the modeling? Or should it actually be a separate thing that you go from DHIS2, you go out and you do various data transformations, taking it back again to DHIS2, so that you can explore both the original and the transformed data inside that system, which is available not just at the country level, but at the district level, so that you can have a lot of stakeholders. And then when that has been kind of approved, that is what you move into the models. So I think it's a really great question. And I think that's why we want to have this platform thinking. And that's why we want to also be very tightly integrated with DHIS2 in order to kind of have the data back and forth. And also in terms of like, what is malaria cases anyway, right? It could be a CSV script, it's a column called malaria, but in reality, even in Herman's demo, right? It's a very strict, different criteria for how you actually record a number that represents something about malaria. And maybe it then needs to be transformed between settings. So that is also why I want to have it as part of the DHIS2 system, so that it can be connected to WHO guidelines and so on. Thank you.
One more comment on the moving fast and the state of the climate app. One other thing is that actually not every country are like Malawi and Mozambique, that the Meteorological Institute are happy to share the data for free. The rest of the world is a bit like, we need to create hope and we need to create ammunition for the Ministry of Health to demand access to data from the Meteorological Institute. So that has also been kind of a case here, that while you're waiting for Godot, while you're waiting for local data, you might have the data that are reported through WMO, through the ERA 5, and then validated with the satellite data. And then later you come in with local data sources. So this is a process, we feel also. It's actually worked so far also in Rwanda. Then they had a decree and a statement and a letter from the Minister of Health that we will have data from the local Meteorological Institute, and they got it yesterday. So this is kind of, it's a process. Wow, More questions? Yeah.
Yeah, you had commented earlier about, I think at the beginning around when you do this modeling, what are you trying to solve for? Something in the near term, a 2-week period, or something in the longer term, 6-month period? So one thing I thought about again is in this idea that you're going to inform, it turns into insight, and you take action. And so one thing over time, I know everybody's struggling with the data and getting it correct, but what would be interesting to do is for those, I'll say, countries or entities that use this model, what action did they take? There's low-hanging fruit that's easy to do maybe, and maybe that's a communication action within a 1-month period. Or if you have 6 months, then it's decisions around what resources. Do I do an insecticide? Do I do a pesticide? Do I deliver bed nets? And it would be good to be able to capture that information from a best practices perspective and see what impact it has. I can say that's what we would be very interested at. So anyhow, something to think about.
Yes, I completely agree. And I think like sometimes we think about some people would see the modeling as kind of a bit complex, but the modeling is in one way very well-defined task, right? You just have, this is historic data, we want to predict ahead. But as you say, what decisions can it really be useful for? That is a much more open-ended, even more contextualized and creative process to find. So I think that's where really also actually experience sharing between countries will be crucial. Yeah, yes, we also do that. But I think just like if Rwanda finds out like one very good way to use it for certain decisions, that information needs to spread out to other countries also. We are into the kind of expert lounge part of it, just so that if, yeah.
Yep, this is not an expert question, so just move back. No, I really respect the stepwise approach, and both machines and humans have to learn. So we need to take it gradually. But is it in your plans on moving beyond the disease-specific monitoring, which is in a way not always contributing to sort of a holistic decision-making on governance level? So is there in your plans a way to sort of combine different burdens, scenarios, and like you've done in other DHIS2 applications where you enable planning and decision-making for very much longer term, like workforce or infrastructure or resource mobilization? And yeah, thank you.
Maybe I'm answering a wrong question, but one part of it is actually already, as I mentioned, Mohammed Semakula, that is sitting as a boss of the climate health desk in Rwanda. He's actually working with us very closely as a domain expert as well. He says they use it across all diseases to see what are the similarities. How can we actually together, because he's a director or planner for Ministry of Health, and they use it more like across sectors, not sectors, but health programs, to see, because there is a lot of similarities of seasonality that can be learned across the diseases, and not only particular malaria, which they started. But maybe there's something else.
Yeah, I could also add to that, like sometimes we talk about models as kind of the end step, a very kind of fancy machine that has been very tailored to one question. But maybe we should sometimes think of it the other way, that actually these kind of quantitative models, like the machine learning models we will put into CHAP, you can run them by a click of the button. So one of the properties of them is that they are in one way extremely cheap to just run before you start to kind of put a lot of effort into tailoring. So I think like just trying to run this and see, and then assessing them is also very easy, because you just run them, you check against reality, you try to predict historically and check against what happened. So in one way, I think what can be interesting here is to try to use it maybe more as a hypothesis generation than as a final solution. And then you can try to see like, what is it that is predictable based on climate? And that can be logistics, it can be, as you say, labor force, it can be a lot of different things, because actually, if you have this as a bit of a generic system, and I saw that in the latest report written by several people from Welcome, for instance, they talked about this, the necessity to move this out from the program silos and work across different prediction targets. And I think then it can be a quite efficient way of exploring to what degree different things are predictable. If they seem to be predictable, you can continue with a more of a manual process to try to develop something tailored. So very, very interesting direction, actually.